If you've ever wondered whether your daily habits could be quietly damaging your penis, this may be one of the most important videos you'll ever watch. Most men don't think about their sexual health until something goes wrong. But here's the truth. What happens down there often reflects the health of your entire body. In this video, we're breaking down 10 things you should never do to your penis. These aren't myths, and they're not scare tactics. They're real, science-backed principles that can protect your confidence, your relationships, and your long-term health. So let's get started. First, don't ignore your penis. Your penis is more than just a source of intimacy. It's actually a powerful indicator of your cardiovascular and overall health. Research shows that men who develop erectile dysfunction are significantly more likely to experience heart problems, sometimes within just a few years. Why? Because the blood vessels in the penis are very small. When circulation starts to weaken, the first place it shows up is often in your erections. Strong, reliable erections require healthy blood flow, balanced hormones, a functioning nervous system, and even good mental health. When you notice changes like weaker erections, less firmness, or reduced sensitivity, it isn't just about sex. It's a message from your body. Ignoring those signals can lead to bigger health problems later on. Address them early, and you might actually prevent conditions like heart disease or diabetes from progressing unnoticed. So the first rule is simple: pay attention. Second, don't try dangerous home remedies. The internet is full of quick fixes and miracle solutions promising to boost size or performance. But most of these so-called remedies are either useless or dangerous. Some men apply apple cider vinegar, oils or creams hoping for growth. Others attempt risky techniques like jelqing, which is a form of manual stretching. But here's the reality. These methods often cause microtears, scarring, and nerve damage. In some cases, they can even lead to permanent erectile dysfunction. I've seen men who created lifelong problems for themselves using these untested methods. Another risk is using homemade constriction devices, things like bottle caps, rubber ties, or even metal nuts, to try to maintain an erection. Many of these men ended up in the emergency room, sometimes needing power tools just to remove the object. If you ever need to use a constriction ring, only use one designed for medical or therapeutic purposes. They're safe, adjustable, and built to release quickly. Never gamble with your sexual health. Third, don't neglect hygiene. It might sound obvious, but many men fail to keep their penis clean, especially if they're uncircumcised. The foreskin needs to be gently retracted, washed underneath, and then dried. If you don't, dead skin cells and bacteria can build up, creating smegma. This isn't just unpleasant. It can lead to infections, inflammation, and even an increased risk of penile cancer over time. But there's a balance here. Overcleaning can be just as harmful. Scrubbing aggressively or using harsh soaps can irritate the skin, leaving it dry, red, or inflamed. The best approach is simple. Let mild soapy water run gently over the area, rinse thoroughly, and pat dry. Avoid perfumes, strong chemicals, and scrubbing. Treat the area with care, because the skin there is far more delicate than other parts of your body. Fourth, don't ignore pain, bleeding, or sudden changes. If you notice pain during sex or urination, blood in your urine, lumps, sores, or any unusual swelling, don't wait and hope it goes away. These symptoms could point to infections, kidney or bladder stones, sexually transmitted infections, or even early signs of cancer. I know it can feel uncomfortable to bring these things up with a doctor, but remember this: early detection saves lives. If your doctor ever makes you feel dismissed or embarrassed, find a better one. You deserve medical care that respects your concerns without judgment. Fifth, don't be reckless during sex. Confidence in the bedroom is great, but safety and control are just as important. One of the most painful injuries a man can experience is something called a penile fracture. And yes, it's real. If an erect penis bends forcefully during sex, especially at the wrong angle, the outer tissue can rupture. The signs are unmistakable. You'll hear a pop, feel intense pain, and notice swelling and bruising almost immediately. Doctors even call this the eggplant deformity. If this ever happens, go straight to the emergency room. It's a surgical emergency, and the sooner it's repaired, the better the outcome. Waiting too long can lead to permanent damage and erectile dysfunction. To prevent injury, use lubrication generously, communicate with your partner, and never ignore discomfort. And remember, if lubrication decreases, it doesn't always mean your partner isn't aroused. Stress, hormones, or medications can play a role. That's why lube is your friend. It helps both partners, reduces friction, and makes intimacy safer and more enjoyable. 6. Don't overheat it. Your testicles are outside of your body for a reason. They need cooler temperatures than your core body heat to function properly. When they're exposed to too much heat, sperm quality drops and testosterone levels can take a hit. Spending hours in hot tubs, saunas, or even resting your laptop directly on your lap can cause problems over time. Even something as simple as keeping your phone in your front pocket all day can have an effect. These little habits might not show immediate damage, but over years, they can add up. So be mindful. Give your body the right environment to function at its best. 7th, don't use excessive pressure when masturbating. Many men develop what's known as death grip. That means using so much pressure during solo activity that normal stimulation no longer feels satisfying. Over time, this can desensitize the penis, cause delayed ejaculation, and make partnered sex less enjoyable. If you ever notice that solo stimulation feels better than intimacy with a partner, this could be the reason. The solution is simple. Use lubrication, slow down, and vary your technique. Retrain your body to respond to a wider range of sensations. Over time, this restores sensitivity and makes intimacy feel more natural again. If you're finding this information helpful so far, make sure to hit that subscribe button. Here at The Healthy Body, we share science-backed tips for better health, confidence, and intimacy at every stage of life. Don't miss the tools that could help you feel your best. 8th, don't smoke and neglect your health. Few things damage the blood vessels in your penis as quickly as smoking. It's one of the leading causes of erectile dysfunction. It also increases the risk of bladder cancer, which is one of the most difficult cancers to treat. But it's not just about smoking. Your lifestyle choices have a direct impact on your sexual health. Eating a balanced diet, getting regular exercise, managing stress, and sleeping well all make a difference. Aerobic exercise improves circulation. Strength training boosts testosterone. Cutting down on alcohol and avoiding recreational drugs protects your nervous system. Everything you do for your general health also benefits your erections and your long-term vitality. 9th, don't beat yourself up over performance. This one is about mindset. Too many men tie their self-worth to their performance in bed. And when things don't go perfectly, they spiral into shame and anxiety. The problem is that stress and self-doubt make the issue worse the next time. And soon, a temporary challenge becomes a cycle. Here's the truth. Sexual health isn't about being perfect every single time. It's about connection, patience, and confidence. Everyone has off days, and that's normal. If you're struggling, talk to someone you trust or seek professional help. You're not alone. Breaking the cycle of performance anxiety can make intimacy far more enjoyable and meaningful. 10th, don't stop using it. There's real truth to the saying, use it or lose it. When erections stop happening, whether from stress, relationship issues, or health problems, the body may reduce blood flow to the area. Over time, this can lead to reduced sensitivity, tissue weakness, or even scar tissue. Nighttime erections are the body's natural way of keeping penile tissue healthy. If they stop completely, it can signal that something deeper is going on. Maintaining intimacy, whether solo or with a partner, helps preserve blood flow, sensitivity, and tissue strength. Even occasional stimulation makes a difference. And if you're looking for natural support, supplements with L-citrulline, like watermelon extract, can help. Your body converts L-citrulline into nitric oxide, which improves circulation where it matters most. It's gentle, stimulant-free, and a safe option for men looking to support better blood flow. Your penis is a vital part of your health, your confidence, and your future. By avoiding these 10 common mistakes, you're not only protecting your sexual well-being, you're also safeguarding your cardiovascular health, your hormones, and your overall quality of life. If you found this video helpful, don't keep it to yourself. Share it with someone who might benefit, and hit that subscribe button for more health and wellness guidance. Here at The Healthy Body, our goal is to give you the tools to stay informed, confident, and empowered. Take care of yourself. You deserve to feel strong, capable, and fully alive.